Let's talk babies. This is a subject I feel very strongly about, not because I'm a mum, but because I'm a therapist and I've seen lots of women over the years who have had a lot of anxiety after having a child and have been given the message, don't worry, it's your hormones. Now, a lot of the time, this comes from a good place, as in somebody trying to make you feel better about the fact that lots of people experience this and it's going to be okay. But sometimes, how it can feel is it can feel like you're being dismissed. And it isn't really fair to put it all down to hormones, because even if there was no hormonal change whatsoever, there's loads of things about having a baby that would make anybody more anxious. Some of the anxiety might be about the baby's health, so you might feel like you have to check on them quite a lot of the time, or you have to sterilize things a lot in order to make yourself feel like it's clean enough, that kind of thing. Now that actually makes complete sense. Babies can often feel really, really fragile. Like when you get home, they're so tiny. And actually, if you've had any health complications throughout the pregnancy or during the birth, it can give you a real heightened sense of that some things can go wrong. Can somebody tell you that you being anxious about that is just your hormones? I don't think that's fair. If you can be kind and understanding towards yourself about the fact that you feel that way, maybe you'll allow yourself to be cautious for a little while, kind of safe in the knowledge that, yeah, when I start to feel more secure, I can taper this off, that's okay. But right now, this makes me feel better. If other people around you don't understand it and are saying you're being too cautious, the effect of that sometimes can mean I can't trust you with my baby, so it's all on me. Again, I can't even trust you to feed them in the way that I want you to, so it's all on me. A useful phrase in this situation is, I understand that you wouldn't do it this way and you feel that this is overly cautious, but this is what I need in order for me to feel safe. So I'd really appreciate it if you could do that. Sometimes the anxiety is about whether or not you're doing it right or well enough. Sometimes that's your own judgments, sometimes it's other people's. You might feel frustrated because the sleep or the feeding isn't doing right, and you might be tempted to come down on yourself about that, like, what's wrong with me? Why am I doing something different? But the thing is, you could do the exact same thing as somebody next to you and have completely different results. With the feeding, for example, maybe it's the way things are flowing, maybe it's reflux, anything like that. But it can make you feel like you are the one that's the problem. And sometimes that's just not fair. It's easier said than done, but try not to compare yourself too much to other people and what's going on for them, because it's just not a fair comparison. Don't be afraid to ask for help, and don't be afraid to change your mind. Neither of those two things are failure or weakness. If it's judgments from other people, I've got another couple of phrases for you. I appreciate your input, but I'm happy with my approach. You might think it's a mistake, but it's my mistake to make. Finally, just remember, it's okay for these first few weeks to not feel completely magical. If you are feeling like rubbish, physically and mentally, it's going to affect how easily you feel you can just stare into your baby's face. See if you can take some small moments for yourself and your baby, but don't put pressure on it to just feel wonderful all the time. It's okay for it to feel hard.